Dr Wenkart, we met recently in Australia when we had a chance to talk for the first time about lots of things we were interested in. And now you've returned the compliment and come here to England, and I've got a chance to talk with you about your career here in Oxford this afternoon. Tom, can we begin by going right back to the start of your life, your parents and early education? Tell us something about them.
Pleasure. I was very fortunate. I had a pretty idyllic upbringing in a leafy part of Sydney.
Sounds good.
It was pretty great actually. I didn't have much exposure to anything except the world in which my parents created, having come out in about 1938, refugees from Europe, and established themselves in Australia very successfully.
Right.
And then being brought up in a very conservative area of Sydney in the North Shore, going to school at a place called Knox Grammar School. In that world I was lucky. It was a musical world, it was an international environment, many overseas guests, mainly from the musical establishment, but equally well my parents enjoyed bringing people home.
Right.
And in that sense I never had any real foresight as to what I did, except my father was a businessman and my mother was more academic or cultured in the sense of music. And for myself I just took the growing up a step at a time.
It was a kind of incubation process.
Yeah, very much actually.
Tell me a bit more about Mum's music, because she was a fascinating person.
Well, Mum's a real matriarch. She is one of those great people that no one does anything wrong. Everyone's great, and probably sets the scene for a world which would be very peaceful. And with that attitude, of course, that showed a great heart and an opportunity that made me feel that there was an exposure outside of the environment that I was brought up in, which is pretty narrow. I mean, it was really quite a narrow world there.
But she was a musician herself?
Oh, low level, amateur.
But attracted musicians to the home, and so you heard a lot of music?
Well, Dad was the main exponent of the outgoing world. He was a salesman.
Right.
Viennese. I mean, the Viennese have that.
What did he sell?
That way. Well, he actually was in the agency world. He did things from electrical goods right down to lace from France.
So he's a great entrepreneurial figure.
Well, to a degree. Not so much a great one, but in a sense a success one, because he was mainly a loner or a solo person.
Right.
And Mum was a tremendous support in that sense. And they made their way very successfully.
In a new world.
In a new world amongst their contemporary world.
And that was revolutionary, wasn't it? I mean, they really stepped on entirely new territory.
Well, the thing they did, I mean, there was a Music Aviva in Australia, is one of the great organisations in the musical world, and Dad was a founder of that, with the contemporary Viennese grouping out there. That was special in its own way. My exposure to that was, of course, in many ways. It wasn't only the Viennese grouping as such, but the Viennese influence.
Right.
The Hungarian influence was downplayed. There was a certain attitude at home that Vienna was like the old empire. It still reigned over the Hungarian empire, and it was quite a joking environment from that regard. It was fun.
So the kind of feeling of a society of people who'd come out from Europe. You got a feeling that there was a kind of strand of Europe in Australia that was there for you. It
was cultivated and fostered, and it was real. And the home was very much like Dad's castle, and he generated that environment of bringing people from all levels, all societies, and certainly from overseas. And in giving, in that, you've got to remember that in Australia in those days, very few people spoke foreign languages.
Right.
Most of the world-famous musicians were indeed Europeans, spoke German or whatever. And my parents were a natural bridge.
Right.
And also when those people visited, it became an environment which those people identified with, and it itself perpetuated.
Right. Very fulfilling situation, really.
Oh, many famous people, Rostropovich, Barenboim, Lily Krauss, I can go on and on and on and on.
Yeah, what a nice background.
Yeah,
that was nice and lucky, wasn't it?
Yeah, I'm very fortuitous. And being
what about brothers and sisters?
I've got an elder sister, and she's pretty laid back and just enjoys life. I'm the one that seems to get up and go.
Right, you're the up and go one. Now, we'll start with that. You went to school, you said, at Knox.
Yes.
That's a famous Australian kind of public school.
Well, private, of course.
Yeah.
I mean, you've got the public, you've got the private. I'm not sure which is the right word.
Same thing, but different words, I guess.
Yes.
And that was good.
Well, it was, again, a fairly local area, and again, I wasn't exposed. And once more, in that sense, I often wondered what I'd do and where I'd go. But I felt confident and I felt capable in myself that the schooling was positive, and until then we were part of a school that was developing in its own right. It's a young private school at that time.
Right, so it was a good time to be there.
Yes.
Lots of ambition. Do you remember staff who were there who were, I mean, probably a headmaster or staff who were taking it in that direction? Can you remember people?
Well, there's two. The headmaster himself was Dr Mackenzie, and there's no doubt he was a great builder of the school, and he generated it from what was a pretty sad situation. There was a lot of conflict into a stable environment and effective results. And he had a bit of foresight with myself, and perhaps you'd like to cover that at some point. But the other one was, apart from the regular teachers, there was another chap who was a French teacher, a chap named Makarov. He was exceptional as a teacher. He was probably the most progressive, aggressive French teacher in the country, unqualified, and he got amazing results.
You went
never
for it.
forget him. You never forget him.
Right.
He used to pick on the guys that didn't have a bit of intellect and really give them hell.
Yeah, and that had a lot of reward, because people did find a way around then.
Well, the challenge of course was to beat him at his own game. Yeah. And that's why I saw it as a bit of fun. That was unusual. I mean, you don't normally get a teacher that in the end you can stand up to and threaten that if he dared touch me, you'd whop him back. And I managed to do that at one stage. Later in the end, I think the classroom just...
it's an important early relationship, really.
Well, yes.
In person management.
Well, it taught me about myself. Yeah. And of course I didn't understand that till later.
Right. You talked about the headmaster having some insight into Thomas Wenkart at that stage.
Well, you know, when you leave school, you always want to get a reference. Yeah. You never know what's going to happen. And I clearly remember the reference he gave me. It was quite amazing. I was taken by it because I didn't really understand what he was talking about. Once again, it was this formative years, and I didn't understand the ramifications of other people's perceptions of what I did or didn't do. And he wrote in that I was very persevering, to a very high calibre of perseverance, and I didn't know it was good or bad. Now that was the cornerstone of his reference, and in many ways, when I look back, it's probably the single characteristic that I've got that I think probably adds up to why I've been able to hang in there.
It's kind of stickability.
Yeah, it is. Yeah. It's real. It's real. If you don't have the stickability, you're going to come unstuck. Yeah. Because when your options come up, you won't be there to take them.
That's right. We'll come on to that in good measure in due course when we talk later in the interview. But let's just stay at school. What actually started to turn the cogs of the mind towards a medical career, Tom? Did it happen while you were at school quite early?
Well, actually, it's interesting. My grandmother had come out from Hungary about 1956, 57, just after the Hungarian Revolution.
Right.
She developed cancer, and she had a stroke. And I remember really on a deathbed, and I was thinking, oh, what a shame. They can't do anything. And the classic idealism of a 16-year-old comes to mind. And then that weighed into my thought process of what should I do. I didn't really know what I wanted to do, but medicine became part of the options. And then circumstance has its method of appearing, as we know, and what happened is it was the first year with the high school results there that the quota system came in.
Right.
So it was clear that if you wanted to go into any criteria, medicine was the first year with a quota. No one else had a quota. The obvious thing you did is you put your name down and you put your suggestions up. Number 1, medicine, 2, chemical engineering, 3, science, or whatever it was, and that became the method of stimulating what I wanted to do. So I then triggered, but the profound direction was clearly my grandmother and what happened to her.
So her demise was really an important precipitant.
Well, it certainly put medicine into the formula.
Yeah.
Well, in the sense of proximity, it was more opening my mind up. Once again, the narrow world. I mean, I didn't know what a hernia was. Yeah. I mean, I didn't know what a hernia was until I went to anatomy in second year.
Right. Yeah.
I mean, limited exposure, a healthy world, great life, on the edge of the bush, riding horses bareback into the bush, fighting bushfires. I mean, this was the way I grew up. Yeah. It wasn't anything...
A rich young man's Australian life.
Yeah. one of the great benefits of Australia, actually, if I could put it to you. Australia in that world gave such a secure environment to grow through the classical early years of life and up to manhood. And that was, I look back on it and I think, I didn't know anything. I hardly did anything special. I didn't do anything different. I just mind games occasionally, but nothing stood out as a school kid or as a younger child.
So, Australia, school, whole range of decision making. And you come into the last years at school needing to get good science performance to go to medical school. That was an easy time? You found that science was your natural area when you got there?
I didn't have a problem with it. I got sick of applied maths, though. I thought the rest of it was all right. I had to pull my socks up at some stage. I think I got a couple of shocks along the way and got stuck into it. But like everything, you just focused.
Right.
You know, had no choice. It wasn't a matter of like or dislike. Just had to do your best. And that's another cornerstone of persevering. I think you just had to do your best. You just apply yourself. So school as such set what I call a very powerful, stable background. I mean, the music, I did a bit of music. I played the violin. I was always seen as the first violinist in my final year at school, but I think seeing it was such a fledgling orchestra, it was not something to write home about, I can assure you. The squeaks were much louder than the tunes, and one had fun doing that.
But I'm glad we flag labelled that, because this is another strand of your life's interest, music, that we'll take on as well in due course. So all these things had happened, and at this stage you now step across Sydney to the medical school.
Yes, and that came out directly, of course, as a result of the results and the options. But once again, I wasn't sure whether I wanted to do medicine. I mean, there was no reason to know whether I wanted to do medicine.
You couldn't tell.
Well, so I took an option in the first year of medical school, and that enabled me to keep options open for another year. It didn't take long into that year where I realised applied maths or the scientific pure maths area wasn't really where I wanted to go. I didn't mind cutting up fish and whatever's appropriate, frogs and so on in the first year. I quite enjoyed that, actually. And I thought the people contact and communications was something that was on target, so I zeroed into the medical second year quite happily. Wasn't a problem. And I think I made the right choice.
And that's right. Well, you stayed with it.
Yes, I stuck it out.
Tell me about those medical school days. Was it a heady time, or was it just a hard working time?
Well, I think it's harder now. From what I hear, medical school, most of those scientific courses or applied courses as such, very aggressive week to week, month to month. In those days we could still do the cram factor, and the cramming factor was a very real one for most of us. So,
save it to the end and then...
Well, yes, you could do it. It certainly caught up with me in the final year. I remember very clearly that I took time out from the whole lecture program to give myself a chance to get through. And I did. I just broke away and just did my own analysis of what was appropriate and charged in and did that. That's also another thing. I learnt the basics in medicine, and at the beginning of the medical course, of course, that was fundamental, and I felt good about that. And the biochemistry side, the anatomy and so on. The clinical years, I look back on them in many ways. I'm sure they could have been better tuned, and nowadays I think they are better tuned. So I think the course has improved dramatically as well. But I enjoyed it. And I certainly did manage to do some other things while at university.
You're going to tell me about those, Tom?
Well, I suppose the best caption to gather up was the final one. And then once again, you know, you have the foresight of your colleagues. I don't know if it's happened to you, Max, but people tend to know what you're going to do or what you're going to be about long before you wake up to doing it yourself. And if it's happened to me, it certainly happened to others. And what happened to me was quite clearly under the caption of my photograph, and the yearbook, the final yearbook, was a little statement. Apart from who I went out with, was a charming bevy of blondes with blue eyes or something like that. The more pointed comment was the one that said he'll have a great career in business.
Right.
That was actually what was there.
That was the analysis.
Fascinating, the analysis of my
But
colleagues.
you hadn't thought that far particularly.
No.
Yeah, you hadn't really gotten around to thinking... Well, you had thought some business, had you?
Well, yes, I'd started to trigger into that on the way through, but it was never taking away the effort, say, from going through as a student on the one hand and doing a job there.
So you weren't
versus
divided?
A deliberate, no, I wasn't.
You weren't divided.
No.
Although you started a bit of property speculation.
Yes, that started. It was another example of feeling your way and why not. When I was going through, I used to get really, not negative or thingy, but I used to think, I'm not earning any money really. I did occasional holiday jobs and so on. Worked down what's called the Snowy Mountain scheme, and that was our big hydroelectric scheme. And I remember going for that job. The first job I went for in formal terms, and I was there first in line. Dad always said, if you want a job, get up there. So I went up there, got in the front row, 7 o'clock in the morning, lined up. And there was this queue of guys wanting it, all, I don't know, 20, 30 years of age. And I was with my colleague for holidays, and he said, the bloke said behind the counter, he says, university student, eh? I felt guilty taking somebody else's job or something. Luckily they had a few jobs around those days. I said, yes, going to work really hard, really prepared to work really hard, and so ended up in parks and gardens. I also learned about the Australian vernacular there. It was fascinating. I mean, you wouldn't believe it. Within 2 hours of starting work that day, it was quite fascinating. The first guy came in, he said, cut it out. You're working too hard. So what's he talking about? Cut it out. 5 minutes later, another guy, hey, cut it off, fellas. I mean, you know, you're working too hard. It's no good. I mean, this was my introduction to working life, you know, and I thought this is a really good go. So in that sense, I started to identify what you would call the Australian norm with my personal aspirations, which was a little bit higher. And in that sense, when I went through medical school as such, I started to see some opportunities. I had another colleague, friend of mine, who's quite a colourful character, had a successful career as a solicitor and local politics and so on and so forth. And he happened to be at New South Wales University, and I was at Sydney University. And between us, we thought we could really do very well. So what had happened is he had determined that if you had a society, you got discounted prices from the union providing the facilities, the dining facilities for balls and other functions. It was about half the price they charged outside people. So he set up this society. It was actually a political science society. It was very good. It was actually a relevant society. And of course the real aim was to create this opportunity to develop alternate income means, which we went and set up, and he got the appropriate authority and authorisations, and we started running these balls, which became quite famous. And
thing of the times.
Yes, the thing of the times. We used to go out and plaster up these billboards at night, out in the middle of the night at 2 o'clock, get chased by university security men all over the place. It was quite fun. And we used to run these balls, and I got my first few dollars that way. It was pounds or dollars then, I can't remember. But certainly it was a lot of fun, and that was a part of the upbringing. We were always fair to our friends.
And you bought a house?
Well, I then saw the opportunity that when it came to move out of home, it was pretty hard to move out of home. You know, the European cooking's very good, so we made it a point to go home on the weekend. That was easy to take. And on that basis, I thought, well, I have to go and rent. So I went looking around renting, and I obviously had some Scottish blood in me somewhere. And I felt it alien to give away something, and so I went and evaluated, well, how much deposit do I need for one of these houses? And the place was in Paddington, which was that in those days a fairly low-levelled, but maybe just turning around psychology environment in Sydney, and Paddington, of course, has become quite a very pleasant area of recycling of houses. And at that stage I got involved with a house with a friend, and we found some deposit somewhere, and we moved into this disastrous place. It was all rotten, falling around us, and started scraping walls and doing things that young guys do to get on the show on the road. And that indeed was the cornerstone. And it was worthwhile doing. Once you had the deposit, you really didn't pay any more than what would have been rent.
Sure.
My parents didn't help me there. They were anti it. It was what you call the slum area of Sydney.
So is that your first real business venture?
That was the first real
the first of many.
That was the trigger, yes. It grew from there. I also learnt to dirty my hands on that, apart from the cubby house at home. Yeah, well, I scraped walls, I did the electricity, the plumbing. It's amazing. I remember the old story. I had these beautiful French doors. I'd pick them up, carried them up on the roof of the car, put them in, and when I closed them, there was this gap this far, you know, not like that. And I learnt to patch that up. They're still good today.
And you're still a practical person.
Yeah, I had to be.
You like to get involved.
Yeah.
Although you've got a lot of paperwork.
Yes, well, but that's made a huge difference. These are memories that I recall that have set a very powerful basis of being able to confront builders, architects, engineers today. It's
which you
quite
have
amazing.
to do all the time.
Oh, non-stop. It happens. And the same applies right through any of the areas of influence I have.
Tom, while you were at Sydney, were there any tutors there, any medics who really were impressive to you? Was it an impressive place for the teaching, or was it fairly straightforward?
I think everyone goes away with a few, probably a handful. Yeah. There was, I don't know why it is, there was a couple of biochemistry guys, Bill Hensley and a chap named, I think it's Jeff Kellerman, but they were really quite an exceptional team. And then there was a couple of O&G guys, always the O&Gs, you see, they always have this panache, must be their way with women or something, but Mays and Llewellyn Jones, two very famous people. Interestingly enough, other than that, I guess the ones that you tend to relate to are those that were clinicians, that were your mentors in different surgical or medical groupings, rather than what are called majors along the way through. No, they don't stand out excessively, just as great lecturers or people like that.
So you come to the end of a 5-year programme or a 6-year programme?
A 6.
Yeah, and then internships?
Yes, I went to Royal Newcastle Hospital. I never wanted to specialise.
Right.
I just got married.
And the Royal Newcastle, I'm just taking, is that in actually central Newcastle?
In Newcastle.
That's the big place
it's 100
in
miles north of Sydney. I never wanted to specialise as such, and so I didn't apply to any of the teaching hospitals. I just didn't want, I wanted to have a generalist background. My interests were general. If I was going to go anywhere, it was general practice. And that was the trigger. So after about a year and a half of newlywed life and moved north and so on, I did.
Tell me about newlywed life, Tom. You married at the end of the university course?
Well, I wasn't even a graduate then. I was waiting for my result.
Right.
And
somebody swept you away?
Well, I was swept away a few years earlier. I just couldn't get away this time. But it consolidated itself. We'd actually known each other for many years intermittently, and it'd come to a fruition there. Christine and I got married in December, which is before.
Was Christine in medicine also?
No, she was out in the wide world.
Right. Yeah. So anyway, that's a widening for the family life anyway.
Well, yes, it opened up doors, and in the sense of attitudes and direction and so on. It had to change the perception of what I was about and what I needed.
And did you go into general practice then?
Well, after about 18 months, I decided I'd learnt enough, having some frontline experience by being in a more regional hospital, major regional hospital. I'd found out what it was like to confront life and death situations. I felt I could handle those, and I felt I wanted to get into general practice and see what was the opportunity there. So that evolved by coming back to Sydney and taking locums for a while. Right.
Just trying to analyse something in my own mind as we go on, Tom, here. In a way, you were turned towards a career in medicine by an emotional experience, seeing Gran run down in a way that you felt you'd like to do more. Did that stay with you? Were you a carer? Were you a natural carer, or were you a more calculated kind of professional doctor who... I meet both kinds, actually.
Yes, I think a bit of both. I think on the one hand, I learnt a lot about myself later on, about how calculating I am, but on the other side, I'm also very creative or idealistic about trying to find reasons or solutions. So between both of them, I guess there was a natural opportunity.
Yeah. There's this creative side that I want to explore a good deal more in the interview. But first of all, take me through this general practice phase. Yes. It didn't last all that long, did it? Did it last?
Well, it lasted actually until I ran out of time being able to cope with the effort required to sustain a good general practice, which is in effect from about 70 to 81. 69.
So it is a decade plus. I mean, we're really looking at a fairly tough decade.
Well, there was a lot happening in that time, yes.
Yeah, well, can we just split that up, kind of take it piece at a time? The general practice time, you imply that it was a pretty hard-working time for you. General practice really was demanding.
I find that it's a great shame, actually, that not enough is done by the GPs of the world to identify how tough it is as a specific one-to-one responsibility.
Right.
People talk about airline pilots, people talk about train drivers and so on. I don't think anyone really understands how tough it is being a good GP. In other words, how much effort, emotional draining, commitment and attitude and effort that is forced into every one-to-one.
Sure.
And that in effect, when I look back, might sound a bit unusual when you think of what I've done and have created in that sense. I'd say it's been the hardest thing I've ever done, doing it properly on a non-stop basis.
Where did you do it? Whereabouts did you do it?
I started off in eastern suburbs of Sydney,
Right.
but also going west, when west suburbs of Sydney, out Liverpool Way, where else, George's Hall, Carramar, places that people just didn't even identify with. In those days, the doctors didn't go there. And of course now they're boom areas for doctors. They'd love to have a decent practice in those areas. But I went into that practice after locums and joined a chap named Jeff Edelston, who has a very colourful career.
And had an important part in your
Well, we were only together, believe it or not, for about 15, 16 months. But that 16 months has always been put together as though it's a lifetime or 20 years of partnership, and it was really only 16 months.
But it was important. It was
huge amount.
massive.
It was a huge and massive impact on what I've done, on what's happened in medical provision in Sydney. A lot changed out of that as to how medicine was...
Can we tease the strands of how that was important then, Tom, at this stage? Can you take me through some of the elements of its importance to that working?
The first element, I suppose, was we created a group practice, whereby the concept of a group practice in 1970 was not other than what you would... Well, no, it was, there was a couple of major, say, groups, but they were in one location, maybe with neighbouring areas. What we did was we created a diversified, geographically separate bunch of surgeries. I mean, literally across town, even in the country. We actually had a doctor up at Lightning Ridge, Walgett and Corinda going around by aeroplane. We had our own little plane delivering him to those areas to do a circuit. Wasn't really in any disagreement with the local flying doctor service or anything like that, but they had bush nurses. And the bush nurses used to be the frontliners. They're like a nurse practitioner today. Simple as that. And then the doctor used to go around in the circuit and catch up with their problems. And we had one of those practices going. In the Sydney we had about 5 or 6. And we expanded that to about 10 or 12 with GPs and some specialists in the group. And they were literally located over Sydney in different areas as well as the country area. So we created this infrastructure, if you like, and that was the first thing.
And quite a big organisation, really. I mean, in its way, a big organisation.
Well, in the sense of employing one way or the other, I think it was probably about 8 or 10 doctors, plus infrastructure. And that was a major. And that then became the basis of saying, well, how do we do a better job? And at that time, there was a lot of problems in general practice. There'd been what was called the Gorton scheme. They'd introduced a $5 moiety between what a specialist got or a GP got, and all of a sudden the gap, the problems of the GP in his relationship with the specialist became apparent. And if you think what's happened since, they're trying to recreate, and they've done to varying degrees of success, the GP as a specialist, family physician or whatever. But at that time, that was the umbilical cord, the traditional method being cut. That was very significant, politically, economically, and from a professional point of view, it started a lot of problems. And in that problem was the demise of the GP.
No, it's about 73, 74.
Well, that was actually 70, 71, 69, 70, 71.
Right at the beginning of the 70s,
Yes, it was. And what that meant was that general practice, the average age was 55, no one was ending general practice, everyone was down on general practitioners, and here I was going into general practice. What's happening around me? And that was the so-called scene which set the attitude, well, what are we going to do about it? And if you listen to your elders, you listen to the system, I mean, there was nothing to be done. It was a dying disease. GPs were dying. And that was all there was to it. So from a practical point of view, it raised an opportunity. because it made us, as young doctors, here I am coming into this wonderful profession and there's no future.
It's sinking.
It's sinking. Rather be on a desert island.
So what did you do, Tom? What were the first things that you did?
Well, what happened was that IBM was around in those days too. And Jeff rang them up. You see, at that time there was in the Kaiser Permanente in America, they were starting, the HMOs had been going.
Right.
And they'd got this thing called multiphasic screening. So we didn't really agree with multiphasic screening as such, which was blanket testing on everybody.
Right.
But we thought there was a compromise, and we wondered how we could get computers out of a central location. And IBM had this thing called Call 360, which you could ring up, connect on to a telephone via a modem, correction to the computer via a modem to through your telephone line, and you could then use the computer in a normal way, even though restricted in speed. And that's how we started to provide a service in our surgeries, which in fact even today would be unique, and that was a decentralised form of total service using computers. And in those days we had, literally 1970, I think it was the third largest network in the world of doctors, well, not of doctors being the third largest network, but the third largest network made up of doctors' surgeries.
Right.
And they were linked through the telephone system to their surgeries, where we provide services. And those services were diagnostic services as well as computer facilities.
Right.
And everyone thought it was a great idea, except it's such a shame that these guys did it, you know, the establishment. And I learned about establishments then too. But one of the interesting things I still look back on, and it's going to happen again, not least through us in the coming years or so, is that we actually did history taking in 5 languages.
Right.
We did French, German, English, Italian and Greek. We used to change the golf ball on this telly type thing.
Right.
And when you think about multicultural and ethnic groupings today, why we don't have this same thing everywhere in every doctor's surgery, I don't know.
Yeah.
But the result was back to the doctor immediately in a summary form in English. Well, that was quite special if you think about it. Instantaneous.
Yeah, this is 70.
It's still not existing. That was 1970. And we're in 1992 and still not happening. And yet we need it more and more. So perhaps I ought to do something about it and stop talking about it. The bottom line was that was the cornerstone of something, and that ended up blowing up into a huge cost, but we had a service and a concept which a lot of doctors obviously wanted to take part in. That introduced the concept of prevention, and we called the service Preventicare.
Right.
And prevention in general practice was something that was unknown, and it enabled doctors a total flexible use of these resources however they saw fit, but it opened up a whole philosophy of boosting the GP and gave him a better environment to work in. And that in fact was one of the first major steps that I got involved in change, and it's certainly the relic of that has been a positive one in many, many practices, many, many attitudes. There's a lot of doctors around there who still recall those days and what it did to their own practice.
Tom, I'm just going to go through it for me, just to make sure I've not missed any of that, if I may. It may be terribly boring, but I'll go through them. You took in the early 70s, right at the beginning of the 70s, the idea of linking doctors through a computer system, a computer network, with resources at the centre that you provided.
Correct.
That were multilingual and that provided health education, prevention. You also had a backup of analytical services?
Yes, laboratory services.
So they would send in samples on a regular basis to you? So
well, the courier network was there, linking up from their surgeries so that you could take in specimens.
Right.
But the results in those days were actually put out over the computer terminal.
Right. So you provided the courier service as well, though?
Yes.
This is tremendous. And you provided other things like medical education at the same time. You got ideas across
there was medical education on the computer terminal. There's also stock exchange reports, which didn't go down too well with the establishment again. You can well imagine doctor's surgery in the middle of the Poseidon boom when we're having reports twice a day on the value of the doctor's shares, you see. Doctors liked it, but the AMA perhaps thought it was inappropriate.
And so your network really became quite popular. How many doctors took this on board?
We had 250 surgeries, which would have been 500 or 600 in 1 year. And that was the third biggest network in the world. Right? And of course, the inevitable happened. Being naive, inexperienced, totally devoid of cash, not knowing how to handle this sort of thing, administratively blowing our minds, of course we ran out of money. And we had some backers, and they ran out of money for the purpose, and the crunch came.
You're in trouble?
Yeah, real trouble. Deep. Right deep.
So you
as
could
deep
have
as
blown
one
it?
needs to walk in. Blow it, as close as I've ever been to blowing it.
We came through that particular valley.
The valley was quite a gorge, actually. It
Took several years.
Yeah, it took several years. What happened is that at the same time I determined that it was inappropriate being in partnership with Jeff Edelston, and everything happened on the 30th of June 1971, actually.
Right.
We went into provisional liquidation with the business, owing about $1 million, and I decided I'd finish my partnership with Jeff because I couldn't handle his approach to doing things and spending money. He spent money before he got it, and he conceived ideas before they were evolved. So as a result, there was a lot of running before you could crawl.
Yeah, and that's a lot of wastage.
Well, in the end, you might have 100 ideas, but you end up trying 100, whereas you should in fact only try maybe 5.
Yeah. So here you've got an enormous deficit of $1 million in 1971, which is quite a lot of dollars in those days.
Yes, I'd say if you did your calculation backwards, you'd say it'd multiply. I guess it blew me out of the water a little bit, but I just crawled into my foxhole and pulled down the battens and
you kept going?
And fought, persevered was the word.
That's
where
we're back to the theme.
Yeah, the theme.
The school
absolutely.
vision.
I just hung in there when they wanted to take it away from me. The Labor Party came along too. This is colourful.
Yeah,
that's a good one. 1972, the Labor Party came in. Our current Governor General happened to be around at the time. I spoke to him after many years later and said how grateful I was that he brought in the Medibank scheme, because probably without it I wouldn't be as well off as I am today. And we had a bit of a joke about it. But more interestingly enough, he was also party to a situation at the time where there was a bit of an effort to take over our distraught company structure, owing so much money, but the business was kept going. The chap that came in, the provisional liquid, I said, hey, this is a great idea, great business. I just hasn't got any money. I mean, you start off with $2, run up a huge business that quickly, of course. And he said it's a great business, so he tightened it up, and of course the net result was that the Labor Party started taking interest, not overtly as such the Labor Party, but more particularly senior elements saw this as a way to establish what was called the Chifley Foundation. You might remember Chifley was one of our great Australian Prime Ministers, Labor Prime Minister, and they wanted to set up the Chifley Foundation. So this became a real focus to take it over and use as a means, unsaid but very clearly, to take over private pathology. They had an opportunity second to none, and I went to town to stop it. And it was a fascinating experience in learning how business operated.
There's a real pressure for government to get in at that end and really do testing in pathology.
Well, it wasn't so much doing the testing, it was seeing the so-called money stream. If they made it a non-profit, Chifley Foundation on behalf of the Labor Party, just think of the cash flow to the Labor Party. Fascinating opportunity. And that was hot to
And this
try.
is tied in, you mentioned the Medibanks, this is all part of the same Medibank.
Well, Medibank came a few years later. But the Governor-General of the day, today's day, he happened to be around at the time as, I think he was the Labor Party threatening to come in with the next election. It was pretty clear that Gough Whitlam was going to make it. And indeed he did, and of course the threats were out, and we all felt vulnerable to the Labor Party taking over after so many years out of power, and one of those was indeed the Chifley Foundation concept. So knowing they were going to get in, it was very intimidating. I mean, when you think about it, I followed my instincts. Again, I learnt more about myself in those years than I did in previous years. Just following instincts, survival, making it happen, persevering, hanging in there, take every option and maximise it. I mean, this is real character-building stuff. I mean, I didn't need the Boy Scouts.
Big business. By the real hard line.
Well, you know, when you owe IBM, I don't know how much, and you owe this other chap, I don't know how much, and Burroughs, and all these big names, and then you're having these venture finance guys over your back and demanding guarantees from your parents, and you know, just to pay the staff's bill next week, it's quite a pressure. And not wanting the staff to be let down, not understanding the concept of provisional liquidation, thinking bankruptcy is the worst thing that could ever happen to you, might lose your medical licence, all this sort of thing. It really had, so it's very good,
writing
actually.
could have been on the wall.
Yeah, well, when I look back on it, it was the worst mental period of my life. It's the closest I've ever gone to...
That go right through the 70s?
No, fortunately it only lasted about a year, well, probably about 4 or 5 months, but they were aggressive. Right. It was survival. It was trying to survive.
It feels a long time, but it wasn't. Yeah. It was a short time.
But that's what I said. It was an amazing period of time where I experienced 20 years of business in, say, a year and a half to 2 years.
What were the personal costs on you?
Well, they were pretty heavy, obviously. My wife stood by me. I can't say she enjoyed it. I didn't enjoy it, but I just hung in there. What we did, actually, after we split everything with Jeff Edelston and just... We had our practices that I talked about before, so we kept those going. Right. But we split them down. I took a tight group of 3 of them in the eastern suburbs of Sydney, so I'm going to make them work very well. And I did, and I applied myself, and Christine helped me through that and helped run the accounts and so on and so forth. And that became a very interesting focus of administration, practice management. That taught me another hands-on job, notwithstanding the big business opportunity. I saw that the same principles applied right through.
To good general practice.
Yeah, exactly.
Right.
Practice management in those days.
You kept feet well on that while the turn came.
Oh, absolutely. Well, fortunately the practices were good, and we made them better. And on that basis, that carried me through the personal liabilities of... I don't know if you've ever had to go through paying guarantees off that another business has lost and your ex-partner's not paying his half, but that becomes quite a chore and a lot of money when you've got a lot outstanding.
Did this have a toll on health, Tom?
Yes, I'm sure it did. The family history isn't the best at the beginning of my life. I'm looking back on it, but when I relate it to it, they were erosive years on my personal well-being. I certainly didn't exercise the way I do now, and I really felt that it wasn't going to be around too long. And with family history the way it was and the way I felt, it's quite interesting how I felt literally like I was running down. And I was.
You ran out of a lot of steam. You ran out of steam.
Yeah, I really felt I ran out of steam.
And was it soon after that kind of crisis period that you had first problems with cardiovascular system?
Well, it was interesting. The heat of the day, if we could call 1970 the heat of the day, tended to settle down into a pattern whereby the business was kept and changed from what was called provisional liquidation into a scheme of arrangement, and that came after they tried to do the Chifley Foundation thing. The impact of that was stability reigned, but it was always on the basis we're going to sell the business to somebody else. And of course, once again, I learned how to manoeuvre things. I worked out how to get around the system early, but I thought business was a gentleman's game as well. I certainly learned that staff, politics, business, no gentleman if they don't want it. And so I decided I was going to apply what I'd thought through before. I went to my legal advisors and I determined that there was a way to control the destiny of this outcome, even though there was all this money outstanding. And I learnt that if you have a certain number of votes and a certain amount of money, you can control the creditors' meeting. And I'd worked this out, and I was told it couldn't be done. So I went along to my solicitor. I said, "Do it." You know, he's now become a famous QC. He said you couldn't do it. I said, "Do it." So he did it. And of course I was right. I ended up for, I think, even though there was about, say, $1 million of debt, I think I spent through a third party about $5,000 and got control of the whole future of the business. So I could go quietly into a more peaceful thing as the practice actually was very successful. It became a pathology practice. And in the meanwhile I could live a fairly good life in a peaceful way, just tidying up. So
it's a slow matter of eating away at that debt and paying back.
It took about 3 years, but the good news was that everyone got paid back, all their money, including interest, within three and a half years, which was very exceptional. And then the showdown came with Edelston, because of course when we went into it, They were expecting to sell it to somebody else, but in the end it came back to us. And he started playing up again. And
he'd still got a shout.
Well, that was the leftovers of the old days, you see. They thought it was all going to go past in the scheme of arrangements. It set some interesting law, actually, the whole structure. They did a pretty good job. And the net result is that we were back together again, and I couldn't stand the thought, and he was playing games again. He took over a thing called John Valentine's and was manipulating, but the end result was I said, look, by Friday, if we don't have a deal, I'll shut the place. And it was a very successful place, and everyone thought I was unbelievably stupid. But I meant what I said. If I didn't have a workable solution, I was going to cut the corners and walk away from it all. And it was a very big, successful business. I was going to close the door. I learned something else about myself there too. And anyway, we made an arrangement, and from then on I was in control to establish my own direction, and that's where I developed the master plan for what I've got today.
Right. When you said I learned something about myself at that stage, I was just thinking, you were able...
The principle versus the money.
Yeah.
The principle was more important than the money.
Right. So Edelston's gone,
Yeah.
and did he make a successful career in other directions at all?
Well, he in 1984, which was long after that period, of course, he in 1984 started what was, I'd say, is the future of general practice, certainly in Australia, and probably around the world, funnily enough. It was by circumstance. He had another arising, if you like. He developed general practice and so on and so forth. But he went back into his own thing and developed this, I don't know if they've heard of it generally around the world, but certainly it had amazing media. Mink couches in a doctor's surgery, white pianos in the waiting room playing music, marble floors, chandelier lights. It was great stuff.
Kind of tarted at medicine.
Yes, and people charged through the door, so that all of a sudden we got what I would call the proper shop-front McDonald's philosophy of healthcare delivery.
Yeah.
And he fell into that by circumstance.
Right. So he wasn't the visionary, but he certainly grabbed hold.
Yeah, I'd say that's a good analysis, actually. People might have thought it was a vision. It wasn't. It was circumstances.
Right.
I want to do this, I'll do it.
Right.
And that, I can't say the white pianos are still there, but I mean, just imagine chandeliers, white pianos, marble, and beautiful plush seats. I mean, who has that in a doctor's surgery? Not an upmarket Swiss boutique, but I'm talking a downmarket street front in whatever suburb of London or Sydney you want. And he did that. And that, I'd say, has become an awakening of the true consumer side of medicine, which I don't think has really pervaded the medical fraternity at all, even at this stage.
Right.
It's a shame, because I don't think we really understand what a consumer is.
Yeah.
The health industry doesn't.
Right.
Hospitals don't. I don't think the establishment does. I don't think politicians understand a health consumer.
But this is something, Tom, that you've worked hard to understand.
Yes.
So I wanted to talk now. Was the company Macquarie Health Services at the stage we're talking about?
At what stage?
At the stage when Edelston was still around.
No, it didn't. It wasn't there. It only came to being in 1976 when I, in fact, set it up. I thought, well, okay, what do I do? Yeah. And I set a direction and a focus, and contemplated a name, and Macquarie came out of it.
Right. So I'm just trying to tie up the links, because out of the ashes and out of the kind of jettisoning of Edelston came something quite new.
Yes, indeed.
But it took a lot of the old with it.
Well, I'm a great one for using what's existing and merging it all together into a workable opportunity. It's no good recreating wheels, reinventing something here and there, when you in fact take a bit of this and a bit of that and put it together and create something better. And that's probably what I've done best, and that's exactly what happened. I contemplated a future of healthcare delivery.
Right.
I tried to foresee the elements which consumers would like. I mean, in those days, in the 70s, consumer wasn't the word we used. I don't know if you can recall when we started to use the word service.
Yeah, right.
They just didn't exist. So when I look back, those were the words that today are well understood and reflect an actuality. But the evolution of what I created was to try and create an effective organisation from scratch that had a future. Right. And that was the most cost-effective way of delivering healthcare.
Right.
And I think that's something that's evolving out of what we've got today with what I'm doing. I think that a traditional means of providing health care is a problem.
Yeah.
I think there's too much fragmentation, there's not enough integration, there's too many egos, there's too many establishments,
Right.
there's too many institutions. But if you think about it from a consumer viewpoint, why shouldn't health be a variation of the shopping mall or some other facility where they want to go and buy food or retailing aspects of their life?
Right.
And one-stop health environments,
Right.
institutions, I think are quite okay. I think it'd be most appropriate if we had more of them. And that's indeed what I started to piecemeal together, not having the full vision or mission.
Yeah.
But that's what happened.
Right. Tom, are you going to be able to tell me, in the time we've got available, about the way in which, well, the main stages in the evolution of Macquarie Health Service?
Well, the corporation, as we've now called it, it started off with the pathology side,
Right.
the diagnostic side, but there was always a story there to encourage diagnostics.
Right.
So that started and
Right.
evolved from what was left over from the old days, going back to the early 70s. But in 76 on, I started to look at hospitals.
Right.
And funnily enough, the HMO concept in America was one of the triggers,
Right.
because I saw an integrated city, Sydney,
Right.
with hospitals, diagnostic services, general practice. And I thought, well, if they're all linked together in some way, then you have an HMO.
Yeah.
So you can integrate it and talk to health insurance. So in fact, that became, if you like, the vision. How do you integrate these things? How do you pull them together and enable a consolidated service in one area? But opening up a range of flexibilities in that service as well, integrating a whole lot of resources more cost effectively. And so it started the hospitals, diagnostics laboratory, the technology side, because you need to know about computers, and I've been in computers since the early 70s, of course, with the original preventive care idea, and then slowly merging it. And then medical centres became part of the inevitability of what Edelson had done in '84.
Right.
So if you had trouble dealing with doctors as consumers, believe me, I don't know of anyone that hasn't, I can assure you everyone feels a lot more comfortable dealing with the public, because they're more rational. And if they're more rational, it makes it a lot easier to develop an organisation, because you know what's going to happen tomorrow to a large degree. And that's an evolution, what's happened from the early days. So now it's all coming together. Now we're with telecommunications and modern technology developments, computers, telephone, digital networks and so on, we've been able to pull it all together. And that's in fact happening. So integration into a health network of all these different infrastructures where the consumers come and use health facilities is natural. And then within a particular medical centre, you can provide a whole lot more activities as a one-stop shop. And that's the future too. And you'll find there's a tremendous cost saving in the community.
Tom, I just want to draw a picture in terms of interview talk. And that may not be easy because Macquarie Health Service is quite large. I've been round it and I only saw a part of headquarters, but you've got a lot of vans on the streets, you've got a lot of network, you've got a lot of telecommunications. How wide does this stretch? Is this New South Wales? Is this broader in Australia?
Well, we go into Queensland.
Right.
If you call Canberra part of New South Wales, I'm sure you'll be recognised. And that's about it. It's about 5,000 doctors or health professionals we actually communicate with.
All networked with your organisation?
Well, networked through leased courier networks and hopefully through computer networks as well within the next couple of years, 2 to 3 years. And that as a basis is going to be a major opportunity.
So you've got a dialogue with all these practitioners?
Yes, and you open up doors to opportunity for them too.
And so they want something special, like some kind of special health education organised where they don't have the expertise, and they can ask Macquarie as the central organisation facilitating to actually provide it.
It's an opportunity, and we take advantage of that to help them. It's part of the goodwill. You know, you've got to be able to give back something. And in addition, obviously, to that, we've been able to do other things through other interests. There's the foundation and other interests we've got
The Wenkart
providing some-
Foundation,
yes,
yeah,
yes.
which is supporting a lot of young artists.
Well, not only artists, but health science graduates and
Right.
other related faculty members from the point of view of giving them an opportunity. But we steered for the young people. We found them very much something we enjoy supporting.
Great. Tom, as we move towards the close of this particular interview, and I hope we'll talk several times more to build up a profile of what you've been building, because this would be too shallow one occasion to discuss it all. But I'd like to look ahead now to the great new hospital that you have in mind, which I've seen plans of this, and it's just fascinating. Perhaps we could just put that on the drawing board, because when we meet next time, perhaps we can start the interview, our next interview, with the drawing board, and probably even later on actually have some film of the hospital as it takes shape, so that we build the story that you're building.
There's no doubt that the hospital breaks through all the barriers and supplies all the futures.
Yeah.
I've travelled long enough and far enough and wide enough around the world now to feel very confident, and just last week I was talking to an architect who's been lecturing on the Hospital of the Future in America for 2 years, since I saw him before with another chap, and associated with Jeff Goldsmith.
Right.
And there's no doubt it's the one hospital that probably puts it together in a futuristic way.
Right.
We call it a health hospital.
Yeah.
We want the patient who leaves today to want to come back tomorrow.
Yeah.
So they're our missions.
Right. Because it's providing health.
Yeah, but the total concept, and it's all integrated, and one-stop shop, the whole philosophy of it, and the health hospital philosophy, bringing the spa bath of Wiesbaden to the hospital in Royal Prince Alfred Grounds in Sydney. That's the opportunity.
And this is the new Prince Alfred Hospital.
Yes, it won't be called Royal, it'll be Prince Alfred Private Hospital, and it's on the same campus as the Royal Prince Alfred and the same campus as Sydney University. So it's an exceptional site, but we see it as a model for tomorrow. The costs, by the way, in spite of it being such an amazing facility, 400 beds potentially, 150 hotel rooms, all linked, major operating facility, daycare facility and so on. But the cost, the operating costs, we anticipate will be significantly less than those currently in place in existing institutions. The design of the place in itself opens up consumer satisfaction as well as operating efficiencies, which is an amazing combination when you think it's a win-win. And why hasn't it been done before? It's a great sadness. It's the only hospital I really know that's being built today that thinks about 20 years down the line properly to some major degree compared to any hospital I know.
And reflects a lot of Thomas Wenkart.
Yeah,
Because a lot of use poured into the plans that I've seen there.
And how?
Yeah.
I'm enjoying doing it, by the way.
It is the most remarkable place, and as I say, in our next conversation together, perhaps we can explore the plans and use that as a basic starting point, talking over the plans of that new hospital.
Tremendous fun, Max, and I hope by that stage you'll have seen it as a world-class, world award-winning architectural as well as health facility.
Tom, it's been nice talking to you.
Thank you very much, Max. It's been a pleasure.